The next talk is by none other than Dr. Ashay Karpe, sir.
Um, uh, Good morning, everybody, and thank you for joining us on this wonderful academic feast. So definitely today is the day of immunotherapy, and I'll be discussing LBF 51 Empower Lung 3. It's Cemiplimab in combination with platinum doublet chemotherapy in the first-line treatment of advanced NSCLC, where we do not have any targetable mutation. This was presented in ESMO Congress 2021 in mini oral sessions and NSCLC metastatic. So this was a randomized two-part phase 3 study of first-line treatment patients. It has included both squamous as well as non-squamous stage 3-4 patients without any actionable mutations. It was a double-blind part 2 of the study. Patient enrolled irrespective of PD-L1 levels and compared with the clinical activity and safety of Cemiplimab and anti-PD-1 plus platinum-based chemo versus placebo plus chemo. Patients were randomized into 2:1 fashion, stratified by histology and PD-L1 expression to receive Cemiplimab 350 mg once every 3 weeks and placebo every 3 weeks for 108 weeks or until progression, plus up to 4 cycles of chemotherapy, followed by mandatory pemetrexed maintenance for non-squamous cell patients assigned to pemetrexed containing regimen. Primary endpoint was overall survival, and key secondary endpoints were progression-free survival and objective response rate as per blinded independent central review. This report is a part 2 results from the pre-specified second interim analysis. So overall, 466 patients were eligible. 312 patients were randomized to Cemiplimab plus chemo arm and 154 to the placebo plus chemo. Median age was 63. 57% had non-squamous NSCLC and 85.2% had stage 4 disease. The median OS was seen 21.9 months with Cemiplimab plus chemo versus 13 months was with placebo plus chemo with hazard ratio of 0.71. Cemiplimab and chemo was associated with superior median PFS, 8.2 versus 5 months with hazard ratio of 0.56, higher overall response rate, 43.3 versus 22.7, and longer median duration of response, that is 15.6 versus 7.3 months. Definitely incidence of grade 3 where side effects were more with Cemiplimab chemotherapy arm, 43.6% versus 31.4%. This is in brief all the results. Look at the complete response rates. It was 8 out of 312 in Cemiplimab, 2.6%, while 0 in placebo. Partial responses were 40% in Cemiplimab plus chemo versus 22.7 in placebo plus chemo. So duration of response by Kaplan-Meier estimated was 15.6 months in Cemiplimab chemo versus 7.3 months. So to conclude, in patients with advanced NSCLC, first-line Cemiplimab and chemo demonstrated clinically meaningful and statistically significant improvement in overall survival, the progression-free survival, overall response rate, and duration of response rate versus chemotherapy alone, with a safety profile consistent with Cemiplimab monotherapy and platinum-based chemotherapy. So definitely in patients where we do not have any targetable mutations, we definitely have maybe a newer option, so we can offer them. Thank you very much.
Thanks, Ashay, sir. Now we move on to the next session. Next session is coordinated by my dear colleague, Dr. Hollis.
Thank you.